Welcome to CareTalk, your monthly source for incisive debate on healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
All right, John, I said incisive, so I'm expecting great things from you today. Let's talk about drug prices. The president's talking about it. You could talk about it. I'm hearing things about freeloaders overseas. I'm hearing about Medicare negotiating drug prices. What do you think?
Well, let's focus on what really matters. The reason we have a drug pricing problem is because Big Pharma jacks prices up every month on conventional drugs, not the unconventional, the new stuff. I think we need to create a market which supports that. But it is insane that we would allow pharma companies to jack up the prices on things like insulin and EpiPens. We should tie those to the consumer price index. And frankly, from a global perspective, the U.S. taxpayer, the U.S. consumer should only be paying the equivalent of the global average. We've created too much power on the part of pricing for pharma, and the problem is pharma pricing. Please don't trot out the conventional arguments about insurance companies and PBMs. The reason why drug prices are too high is because the drug manufacturers set them too high.
John, I like your idea of separating out those really innovative drugs, and I say, okay, so what? We pay a lot for that. I'll take the innovation to bring out the new immunotherapies or whatever may be the cutting edge. But once a product's on the market, let's be tougher. There's no doubt about worrying about keeping innovation going there, and let's be smarter about it. And frankly, I think what the president criticizes about freeloaders elsewhere is actually those national systems being smart on negotiating, and they're not paying that kind of dollar for EpiPen or insulin. So I think the combination of the U.S. and what they do elsewhere is probably a good idea.
You're just using that as a way to kind of support your president, Mr. Trump. So what do you think of where we are in the VA, David? I mean, he appears to have, his last VA head appears to have blown up, as we predicted.
Yeah.
What happens next?
Well, John, you were more. I didn't know what you were talking about last month, but you said that you want to stay out of the way whenever the president is hiring or firing. And it turned out that the president's personal physician, who had a great job before, just had his name dragged through the mud after that. And it was entertaining, but really sad. Actually for the VA. The VA does need a strong leader, and preferably somebody who knows about running a big healthcare organization. So I'm very happy to see that they're talking about people like Anthony Tresigny from Ascension Health, who's run a multi-tens of billions of dollar healthcare enterprise. And I do think maybe we're seeing a pattern here of nominating just whoever happens to be around and then moving to somebody who may be competent. I don't know what your thoughts are about that.
The turbulence will continue. I mean, we have Alex Azar would be a great example of that. And let's hope we get for one of our most vulnerable populations someone who's good. Maybe the best way to make sure he actually gets the job is to have him show up in a uniform. What do you think about that?
That is probably a smart one, John. And I really am deferring to you because you've been very predictive, at least in terms of who's going to go down in flames. So I'm going to ask you about another topic which you're always talking about, and I want to hear you espouse it a little bit more or explain what's what. You talk about big data and analytics, which frankly all the sexy people talk about that. It's very fashion forward.
Sexy.
Yeah, I'm not putting you in that category. I'm saying that's what people say, and so maybe you're copying it. I'm not sure why, but I want to hear you explain why is all this talk about big data and analytics anything different than a 21st century version of the old garbage in, garbage out from the 60s?
Well, put your abacus aside. I mean, at the end of the day, we're actually.
Can I take out my slide rule?
Big data. It's right over there. You're leveraging big data tools right now to actually clean up the data and turn coal into gold. We've got most recently Google announced that it had leveraged neural networks to actually clean up doctors' notes, which are predictably. Hard to read and illegible and not necessarily tied to patients. They're using tools to actually predictively match episodes and patient records to patients. I think we're in the early stages, but they're in their most recent research, they're actually using that cleaned up data to predict mortality, risks of mortality and readmissions. I think it's really exciting, and you're just dead wrong.
Dead wrong. Well, at least I'd rather be wrong than dead. But John, I would say that there's a lot of kind of black box sort of nonsense and a lot of hocus pocus going on.
You don't understand.
No. But I think you really have to separate out kind of like the wheat from the chaff here, and that there is a ton of data that's generated in healthcare. We have to leverage it much better. There's new data, not just from doctors' notes, but genomic data, information on the quantified self, a lot that's happening. And if we're smart about it and we support the type of innovation that's going on there that can happen in other fields, you'll actually make a big difference in healthcare. And I'd love to see it there as opposed to just advertising or getting people to change their vote. So I'm hopeful.
Whoa. So are you hopeful about what's going on in the People's Republic of Massachusetts, where the largest, most expensive system, Partners, is talking about an unnatural act of merging with Harvard Community Health Plans, which was started as an efficient alternative for doctors to compete with legacy systems? What's going on in Massachusetts?
So John, I love speculating about mergers. Everybody loves that. Put this together with that together. Now, usually it's investment bankers, and I don't know they'll make as much money on a deal with two big nonprofits. So maybe they're fishing in the wrong pond, as you may be suggesting. I think what's happened is, Partners ran out of the ability to acquire any more little guys because they've been getting pushback from the state, and Harvard Pilgrim's looking around and they can't do it either. Everybody's worried about, what to do next. Everybody seems to be merging. Everybody seems to be worrying about Amazon. Well, let's just throw that idea of a merger out there. I also think there's this long-standing...
You snuck Amazon right in there.
Amazon is just totally like Alexa came right in. I hope I'm not turning anybody's echo on. Alexa, who can tell us what's happening? But the other thing is there's this ongoing fantasy, John, which you probably entertain as well, about payers and providers coming together and making some magic elixir. And to me, it's like the Rodney King thing or the LA riots and saying, can't everyone just get along? Whereas the natural state is payers and providers having tension with one another.
I just think for me, the most important thing about scale is efficiency. Now we're talking about aggregating scale to promote or sustain continued inefficiency. That's the biggest challenge here. And I'm hoping the regulators are skeptical, or at least will get some commitments around better patient care at lower cost, because that's what the people in Massachusetts need.
All right, well, John, speaking about efficiency and not having wasteful spending, I'm sure you're happy to see that the Congress is considering reducing food stamps just with a snap in order to pass the agricultural bill and knock down that deficit, that Obama deficit.
It's infuriating.
What?
That at a time when people in healthcare are refinding that we need to actually deal with whole patient needs, called social determinants of health, a phrase that only an economist could love. One of the most elemental is hunger, that we're talking about throwing millions of children who are currently only getting $35 a week to support their hungry households off of the government rolls. It will drive costs up. I mean, just look at Geisinger. One example, Central Pennsylvania has provided free access to decent food, blueberries and broccolis for diabetics. It's reduced complex diabetics cost because they're reducing their hemoglobin A1C by 200 basis points. Every other OECD country spends 3 times what we do on social supports, things like food and housing, than we do for every dollar spent in healthcare. And the net dollar spent in terms of both social and healthcare is lower, and the costs are rising slower. We're making a devastatingly bad mistake for those families and for healthcare. We're cutting the budget now, and even in net terms, it's just going to drive more costs up in the future. It's insane. Watch. And please make sure that those kids are not thrown off the rolls.
So, John, I do think this is an example of ideology getting the better of sort of common sense and moral decency and even just plain economics. So, an organization that may be like Geisinger that may actually be at risk for the total cost finds it worthwhile to spend money on fresh produce. So I see you're amped up, which is only good in one sense, which it probably means you're ready for the lightning round, are you?
I am. Are you?
I'm almost ready, John. I gotta go over to wardrobe for a minute first, okay? Can you hold on for me?
Fine. David, I know you want to be supportive of Melania's new campaign, but her campaign was about be best, not wear vest.
Well, John, I think you misunderstood. This is my be best vest. I was thinking, what would Ivanka do? And that's what I came up with. I mean, John, come on.
China.
Opioids, cyberbullying, well-being, what the heck?
Well, the good news is that she's still using the talking points from the last First Lady.
That's true. That was be better, right? Be best? I get it now. Terrific. Be better, wear a sweater. All right. So, John, listen. Obamacare has been repealed, but one thing that Trump let go through was the idea that you have to put calorie counts on the menus for these chain restaurants. What do you think of that?
Well, I think it's going to be a surprise for him. And I think it's sort of perhaps maybe the next step would be to add what nutritional value is being provided through these counts. But it's probably a decent idea.
You know, I think if you're trying to have people eat less, they should just put bacteria count. That should help.
So David, what do you think of this new sort of policy impulse on the part of the states to, rather than pay for Medicaid, try to put in lifetime caps on Medicaid spending?
You know, John, Kansas said they want to limit Medicaid eligibility to 3 years. I would go exactly the opposite way and say actually put everybody in Medicaid, everybody on the exchanges, and make it Medicaid for all. That's the path to universal care.
I think the better path is probably Medicaid managed care and that would be a way to bring things down. But I think we both agree that lifetime caps are sort of silly.
So John, what's your personal health goal for the summer? Assuming you have one.
Well, it's to get outside so I don't look like you. Maybe I'll go biking.
I'll lend you my vest if you want. You may need it. You know, get hit by any troublemakers, especially making a lot of enemies here on this show. John, you know, as you know, I got hit by a car a few months ago, so maybe I need to keep the vest. But I want to be able to hike, go for a big hike at the end of the summer.
Awesome.
Well, that's it for this month's edition of CareTalk. I hope you've enjoyed the incisive debate. And if you like what you hear or what you see, please subscribe using your favorite service. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks.